Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We are discussing Pranavasodas Vyadhi, and in that regards, we have discussed Kas, Shwas, Pratishay, Raja Ekshma. Now we will move towards the another disease is which is Swarabhed, hoarseness of voice where patient is unable to speak. Now it is a very common and simple disease, and there is nothing much rocket science for the diagnosis of this Swarabhed, all of you know. Then what is the interesting thing about the Swarabhed? I will try to put for in front of you. Now hoarseness of voice, Swarabhed, difficulty in speak, symptom is clear. Interesting thing is in the types of Swarabhed. Now, Vataja Swarabhed, Pittaja Swarabhed, Kaphaja Swarabhed, they are described in the text, the basic types. In practice, do we find Pittaja Swarabhed as such or Kaphaja Swarabhed as a common? Because when you will take the history of Swarabhed patient, it's a very common observation that when we go to a trip and there is a shouting and much more speaking in a high volume, or we are going to a cricket match and then we cheer up, etc. When such hetu happens, which is related to the talking, mainly with the talk in the high volume and with for mainly much more time, then you will find that patient claims that I have got now a Swarabhed. Or specifically when there is a cold food like ice cream or very cold water is taken, you will find that patient complains Swarabhed. All these things, the hetus which are commonly seen in the practice, always point towards the Vataja Swarabhed as a common Swarabhed type. It is hardly found, we have hardly found about the Pittaja as a Pittaja Swarabhed, because as I said, we had discussed in the Kasa that Pittaja Kasa is very rare, though described in the text, because there is no Pitta dosha sthana in the Pranavasodas as a main sthan. Mainly Vata and Kapha dosh adhishthan is there, and Pitta dosh adhishthan is hardly anywhere in the Pranavasodas except Sadak Pitta in the Hruday. So in practice we will find the Vatavardhak hetu about speak and cold food. Pittaja Swarabhed I have hardly seen, and Kaphaja Swarabhed that patient feels there is a heaviness, etc. is also is seen, but it is seen in the old age whenever there is a laxity of the vocal cords, Shaithilya, and in that case patient is unable to speak. So you can relate that Kaphaja Swarabhed in the laxity of vocal cords mainly. But in my opinion, in practice, all these hetu mainly point towards the Vatavardhak Ahar Vihar, and Vataja Swarabhed is mainly seen. Now, there are other types like Kshayaja or Medoja Swarabhed, which are they seen and how we diagnose that? Now, in my opinion, Kshayaja Swarabhed is seen in the Dhatukshay where there is Sattva Dhatukshay, or mainly when a disease which is long standing disease and patient is all over sinking or have other many symptoms also along with the Swarabhed, and there is no energy to speak. As far as this Kshayaja Swarabhed is concerned, you will not find anything as an anatomical abnormality, but overall Dhatukshay leads to low energy, and low energy leads to the Swarabhed that patient is unable to speak. Medoja Swarabhed many times is related to the tumor of the vocal cords or larynx. whether it is a benign tumor like Granthi or it is a carcinoma or malignant tumor. These tumor or this anatomical deformity in the form of tumor or any nodules on the vocal cords, we can relate it to the Mayuresh Agte. There is another mentioned Swarabhed in the as a Kasaja Swarabhed, where there is because of cast patient can't speak, but it is you have to treat the cast and not the Swarabhed may firstly, and you can have a symptomatic treatment. So whenever there is a Vataja Swarabhed, which is commonly hetu of Vatavardhana seen, you will find patient gets cured in the very few days, all of you know. But whenever there is a long-term Swarabhed, you must think of some other disease like tumor or any nodules on the vocal cords, and you have to go for the proper investigations like laryngoscopy or any other thing, because long-term Swarabhed always denotes to some major illness. Hence, when a patient in the history of the patient is very important about the intensity and longevity of Swarabhed symptom. So Vatavardhak Ahar we are mainly continuous talking or in the high pitch or talking or giving lectures in the air conditioned room, that air currents also help or act as a hetu. Then in the old age when there is laxity of the vocal cords, Shaithilya, you can go for the Kapaja Swarabhed. In case of sinking patient with other symptoms of Dhatushay, you can denote the patient as Kshayaja Swarabhed and give treatment accordingly. And in the case of tumor, any growth, nodule on the vocal cords, you can treat the patient as the Medoja Swarabhed. Another Swarabhed type, or I will say it as a Udaraka or Upadrava, that if there is some tumor in the this area of neck and patient gets radiation for that, and because of radiation the low vocal cords are affected and patient finds difficult to speak. So this is another hetu is seen in the patients. We will talk about the treatment in the next episode. Thank you very much.